Hi, good afternoon, everyone. It's great to see so many of you joining us today. We have a big crowd. Some people are still going to be coming in from the waiting room for the next few minutes. But for those of you who may be new to these calls and don't know me, I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. I hope everyone stayed safe last week during the storms and that people had a chance to relax a little bit, whether it was spring break for you, the veto days, the eclipse yesterday. We've had a lot going on that wasn't the legislative session, which has been refreshing. And today, as always, we're going to have a lot of updates for you on the legislative session, of course, that's in its final stretch. The usual state and federal policy updates and everything that you need to know about the status of Kentucky's safety net programs. I know that most of you are familiar with Thrive Kentucky by now, but let's go to the next slide, Alex. For anyone joining us for the first time, our mission is to meet the basic needs of every Kentuckian through systemic change, because we know that many of our fellow Kentuckians have faced historical and systemic barriers to meeting their basic needs. And so you can see our shared principles on this slide that guide our work. Let's go to the next slide. Here you can see members of our campaign, and if you're interested in learning more about any of our organizations, you can click on these links. You will get these slides as a follow-up. We can go to the next slide. Just a little bit of housekeeping. We have a lot of folks who are going to be on our webinar today, so please be sure to mute your line. We are recording this webinar. We'll send out a link to the recording along with the slides and any of the other resources and materials that we discussed today. And so you'll get a follow-up email with all sorts of good stuff. We'll also be sending you an evaluation in that follow-up email, and we would really appreciate for your feedback. If you are looking for CEUs, if you're a certified community health worker or a social worker and you'd like to receive CEUs, you'll need to complete that evaluation in order to get CEUs, but we want feedback from everyone regardless. And let's go to the next slide. We always want to say thank you to our sponsors for making these events possible. We're able to provide these webinars and our roadshow kind of program for free. And we bring together lots of folks every month for these calls, and really appreciate having the ability to do that. And if you are part of an organization that is interested in sponsoring, we accept sponsorships year-round. Our roadshow is starting in May, actually, so this is a good time. If you've been thinking about it, we can, share more information with you. We have a sponsorship form with additional details. We're happy to always hop on a call, so just let us know. You can reach out to Kelly. Her email is there on the slide. And let's go to the next slide, Alex. Mentioning our roadshow, here's the schedule for our 2024 series, and we'll be starting in May in Frankfort, because we haven't been in Frankfort enough during the legislative session. We had to go back. But this is actually a new location for us to do the roadshow, and we have a few other towns that will be new to the roadshow this year. So we hope to see many of you there. And please do share all of this information with your networks if you know people who would be interested. But our roadshow is an extension really of what we do during these monthly webinars, where we go into more depth about different safety net programs, different needs of Kentuckians, and then talk about policy advocacy and how important that is. So why don't we go to the next slide? Here's the agenda for today. So we'll be covering each of these topics, and as we go, please put questions or comments in the chat. We like to handle questions that way as we go, rather than waiting until the end. And if there's anything that we can't get to in the next 90 minutes, we'll be sure to include that in the follow-up email. So I think I've covered everything now, and I'm going to hand it over to Dr. Schuster to get us started with the legislative update.
Thank you very much, Emily, and good afternoon to you all. Like Emily, I hope that you've been safe during the storms, the storm also being the legislative session, I guess, and got a chance to glimpse the eclipse, which I think put us all back in awe of nature, which was a good reminder. So a team of us actually are going to talk about the legislative session and particularly the budget. But first slide, please, Alex. So we're almost finished. We have finished 58 of the 60-day session. And the legislators will come back to Frankfurt on Friday, the 12th, after the veto period for day 59, and then they will wrap up by midnight on Monday, April 15th. Before we had computers, the legislators would sometimes physically stop the clock and conduct business a little bit past midnight, but they really do have to finish by midnight now, and that's in the Constitution. So we had 1,220 bills filed this session. 178 have been sent to the governor for his action. And if you thought it was busy the very last week of the session, you were right. 161, so that's probably 90% of those bills were passed in the last 4 days of the session. And the reason that's an important goal for the legislators is that the legislators are predominantly Republican. Our governor is a Democrat, and so there is naturally some tension in terms of policy between the legislators and the governor. So the governor has the ability to veto bills, and there's a 10-day period set aside for him to do that, which begins on March 29th and ends on April 11th. They want to get bills passed that they think the governor might veto so that they could come back on those last 2 days of the session and override those vetoes if they don't like the vetoes that the governor has issued. So we'll see what happens in these last 2 days. They also can pass other bills, and they do sometimes pass bills about which they're not quite so concerned about a gubernatorial veto. As of last Saturday, the governor had signed 108 bills, allowed 11 to become law without his signature, which he can do. I think of it as, I'm not wild about this piece of policy, but I don't feel strongly enough or have a reason to veto it. He's also vetoed 6 bills. So those are 6 of the bills that I'm sure the legislature will be taking up as a possible override. I would point out that an override is very easy in Kentucky. It's a simple majority of the House and Senate members. The one bill that he has already vetoed is House Bill 18, which allows landlords to pick and choose whether they want to lease to tenants, depending on where the tenants are getting the money to pay the rent. So if they have a voucher, Section 8 voucher or a military veteran voucher or something like that, some of the landlords don't like to take those vouchers, and this allows them to not take them if they don't want to. So that has been overridden and has been now enrolled with the Secretary of State and will become law. I don't think it had an emergency clause on it, so it will become law in July. And just a reminder as we go through the bills and so forth, we've been playing defense much more than we've been playing offense, as there were a lot of bills that we were very concerned about. The major bill, of course, in the biennial session and the even-numbered years is the budget, because it sets the priorities of our Commonwealth. So I'm going to turn this next part over to our learned colleague, Dustin Bugle from Kentucky Policy, to talk us through the biennial budget. Thank you, Dustin.
Yeah, thank you. Again, Dustin Bugle, I'm the Policy Director at the Kentucky Center for Economic Policy, and we pay very close attention to the budget as it moves through the process because, as Dr. Schuster said, the budget is the single most important policy document that the General Assembly regularly produces. It's also a moral document. It's a statement of what we value as a state. And so we're going to talk a little bit about where those values are placed in terms of the final budget agreement. So the final budget was passed a little bit unusually this year. Typically, we have one executive branch budget and then maybe a cleanup version of it afterwards. This year, we had 2 separate versions. We had House Bill 1, which was, I'll explain here in a little bit, and House Bill 6. The combination of dollars allocated between these two was $1.3 billion less than what we had available to spend on an ongoing basis in 2025. And because of that, even despite a drawdown from the Budget Reserve Trust Fund, we're going to increase what we have in the rainy day fund, from 3.7 to $3.9 billion, which is about a quarter of our total budget, much more than we really need in there. You may be asking why we underspent on our recurring needs and we overshot on what we put in our rainy day fund. Well, the context underlying all of this is the drive from the General Assembly to cut our income tax. And in order to do that, we have to underspend on our recurring expenses and overfund our Budget Reserve Trust Fund. We still spend a good amount of money each year on the budget, and particularly on things like P-12 education, Medicaid, criminal legal system, and post-secondary education. But we're spending less than we have. So let's move on to the next slide. So a little more detail about these two budget documents. The first is House Bill 1, and these are what the General Assembly is referring to as one-time appropriations, about $2.5 billion out of the Budget Reserve Trust Fund. Many of these are projects, things that we build. Some of it, though, is recurring, and I'll explain a little more about that later. The second budget document is what we typically think of as the executive branch budget, House Bill 6, and they're referring to this as our continuing appropriations bill. In it, we're spending $14.8 billion in 2025 and $15.2 billion in 2026. So what's unusual this time around is that House Bill 1 does something called notwithstanding. So it basically looks at the requirements that the General Assembly has set for itself as to whether or not they can cut the income tax. They have to meet these two triggers, and they notwithstand that statute. They say all this spending doesn't count toward that, so we can continue to try and hit these income tax cuts. So let's move on to the next slide. A few specifics that are, I think, particularly pertinent to our group here. The first is the Medicaid budget. So, folks may remember there was some real concern out of the House version of the budget that it cut Medicaid, the base funding for Medicaid, by quite a bit. It was nearly $1 billion once you factor in the federal match. The Senate restored those funds. In the final budget agreement, the House Bill 6 version still shorted Medicaid by about $62 million, which is, much more than that once you factor in federal funding. And so that 62 million was added back in through House Bill 1. So they are essentially not trying to claim that it's a one-time spending amount, but they put it in the one-time spending bill as a way to try and clean up the mess that they had. There's some question about why, if that was really an intention of taking a recurring expense and notwithstanding those statutes, or if it really was just a way of cleaning up an accident. And it's not clear which. A real shining part of the budget is that there were a lot of new waiver slots added for the 1915C waivers that we have, nearly 2,000. So there were 750 new Michelle P. waiver slots, 375 new SCL slots, 750 new HCB slots, which is important because HCB has been, for the first time in a long time, been gaining a wait list. And then 50 new slots for the acquired brain injury long-term care waiver. There was also a considerable amount of money in the budget for rebasing nursing home rates, which haven't happened in almost 30 years, and is really creating a lot of strain in nursing homes for staffing and other things, and leading to higher rates there. And also funding to implement the rate improvement program for 1915C waiver providers. Combined, that was a lot of money. It was tens of millions of dollars. Actually, I think it was closer to $200 million. Unfortunately, there was no funding for mobile crisis units. These are alternatives to calling the police when there's a mental health crisis. This was something that the governor had proposed, that the General Assembly had actually funded planning for in the previous budget, but they did not fund the implementation for it. And also they included funds to potentially do rebasing for all Medicaid services in 2026, although it's not a lot of money. So there's not a lot of wiggle room to be able to do that. So let's move on to the next slide. Childcare is another area where there was a lot of conversation this year because A large amount of federal funding is expiring. You all have heard us talk about this before. Roughly 330 million annually is going away or has already gone away for childcare. And so there's a big, big fiscal cliff that childcare providers and the families they serve are facing. There was new money in the budget to provide for a lot of the policies that those funds propped up. For example, the higher reimbursement rates for childcare providers, in allowing childcare employees to bring their kids to work and their center be paid for that care, doing background checks for childcare employees, some scholarships, but it left out a lot. It left out the higher income eligibility limit. It left out enrollment-based reimbursements to childcare providers. And most importantly, it left out direct stipends that childcare providers had been receiving to the tune of about $50 million per quarter. And we've heard from childcare providers that the absence of those funds is going to lead them to raise already unaffordable tuitions, lay staff off, or potentially close their doors. And we're hearing from parents that they're worried about that, and they're already really struggling to be able to afford that tuition by putting off really essential spending, delaying having children, spacing out the children that they do plan on having so that they don't have overlapping childcare payments. And we're really concerned that that's only going to worsen when that funding goes away without an adequate state investment to make up for it. So let's go on to the next slide. Some other components of the budget that I'm going to highlight, and if you have questions, I can answer them in the chat. I'm also going to put a link in the chat to our budget analysis that we did on the final budget agreement. A few really good things. First of all, there is a 3% salary increase for public employees in each of the fiscal years. That's incredibly important because for almost 12 years, state employees had not gotten any raise up until the last budget. So continuing those raises to keep up with inflation and frankly, to keep up with higher private sector wages is critically important. So it's really good that they did that. They did better funding for school transportation. Still not 100% of what they're statutorily required to do, but it's closer to it and better than they've done in recent years. Those of you in Jefferson County know how critical adequate school transportation is from the beginning of this current school year. There was also slightly improved funding for poorer school districts. They tweaked the SEEK formula so that lower income or school districts in lower income areas of the state got a little more money than they would have otherwise. But they also left out a lot of needs. So there's no funding for teacher raises. There's only a modest increase in SEEK, which is still 26% below 2008 levels. There was near flat spending on supplemental education spending. It's called learning and results services. So that's things like preschool and friskies and so forth. But they didn't even include any money for professional development or textbooks, as has been the case for quite a while now. Modest ground was made on the long-term cuts to higher education, but it's still not enough. Higher education is being funded at 31% lower than 2008 levels. There was no significant funding for affordable housing, and that may even be an overstatement, or disaster recovery. Worse than that, though, they capped the authority of the governor to spend during cases of emergency for the first time, meaning that in very short order, if we have another, God forbid, tornado or flood or ice storm or something like that, it's very likely that the General Assembly will have to be called into special session to fund our response to that. We will hit a point where we won't be able to respond, and that's really obviously problematic. And then finally, there was no cost of living adjustment for retirees. So with spending $1.3 billion less than we have available to us and having a budget reserve trust fund that's so well padded, why are we left with this situation? So let's move on to the next slide. Well, again, the idea here is that in order to hit the triggers to allow the General Assembly to have an income tax cut, they have to underspend and they have to keep the budget reserve trust fund flush. Unfortunately, that income tax cut is extremely expensive. So if you look at the cost of reducing our income tax from 5%, where it was a couple years ago, to 3%, which is where it would be if they met the triggers for the next 2 fiscal years, that's more expensive than what we spend on Medicaid, more than we pay for K through 12 base funding and SEEK, double what we pay for in post-secondary education, and then certainly, orders of magnitude more than the loss of funds that we're experiencing from the expiring federal funding for childcare. So it's a really significantly expensive cut. And because the General Assembly is so motivated to do this, we are underspending on a lot of critical needs that you're going to hear about during the rest of our presentation. So I'm just going to end on that note, and I'm going to hand it back over to Dr. Schuster to wrap us up with several other bills from this session.
Thank you so much, Dustin. And I think Emily put a link to the blog that you had mentioned that KY Policy put out to summarize the budget. And I would really recommend you all. They do it in terms that can be understood, which is great. So I have kind of a truncated list of bills that I think are good, that we feel like are good policy. And here are some that have passed both chambers and gone on to the governor. House Bill 11 has been put out there by children's advocates for some time to regulate the sale of tobacco and related products to anyone under 21 years of age. We still are very concerned about kids starting smoking and starting vaping. And I think there's a particular emphasis on those, the vaping products that are packaged to, be particularly attractive to kids. House Bill 30 establishes Veterans and Families Suicide Prevention Program. I'll talk a little bit later on in the behavioral health part, but Kentucky has a significant problem with our suicide rates among lots of different populations, but certainly veterans and their families is one. One that our housing friends have been pushing for some time, did pass. House Bill 100 would allow people experiencing homelessness to get a no-cost copy of their birth certificate. Having some form of identification about who you are, what your name is, how old you are, and so forth is just incredibly important to open the door to so many services. And the cost is prohibitive for people that are living on the streets. So this is an important piece. House Bill 274 allows pharmacists to give vaccinations beginning at age 3. And this has been important. We are lagging behind in well child checks, which is where typically youngsters get their vaccinations. And I think the whole COVID period raised a lot of questions in people's minds, and there were a lot of conspiracy theories about vaccinations. So really important to have access to those. House Bill 534 prohibits insurers from doing what we call prior authorization, which is a kind of barrier to getting access. In this case, it's for naloxone for the treatment of an overdose. And then one good piece that passed in terms of childcare, House Bill 561 establishes the Child Care Community Designation Program, which hopefully will encourage more people to open child care centers and so forth. We have a couple of bills that are still hanging fire, as we say. It's never over till it's over. One of them is House Bill 10, which has been called the Omnibus Bill. It addresses maternal mental health and provides resources in other areas aimed at supporting new mothers and babies and reducing health disparities. So this bill was on a fast track, and then it kind of stumbled here toward the end. We are still hoping, and there still is time in these next 2 days to get this bill passed. In the same vein, House Bill 199 had passed the House and was waiting action in the Senate when we got to the end of the session before the veto period. And it would establish freestanding birth centers in Kentucky. Kentucky is one of only 6 or 7 states that has no birth centers. And so our birthing moms really have no choice except to go to a hospital or to have their baby at home. And the birthing centers are staffed by midwives. They follow a midwifery plan of care. They're for low risk pregnancies and would give an outstanding choice to moms who don't want to go to a hospital to have their baby. One of the groups that would be eligible to receive Medicaid reimbursement would be the certified professional midwives if Senate Bill 89 passes. And then one that we've worked on for some time, Senate Bill 142, provides paid parental leave for state employees, which is something that we think for the health of families and those babies, whether they're adopted or babies that you've given birth to, that bonding that happens. As a psychologist, I can tell you it's really critical for both babies and their parents to have that bonding time. Next, please, Alex. So we did have two bills in particular that I think are bad bills that passed. I mentioned House Bill 18 already, and that's the bill that was vetoed early on by the governor and was overridden by the legislature, and so it's on its way to becoming law. A bill that is still on the governor's desk is House Bill 5. It has had a tremendous amount of press coverage, and tremendous number of advocates and advocacy groups have worked for its defeat, actually. In the name of creating a safer Kentucky, it would increase prison terms, it would create more felonies, and probably from a behavioral health standpoint, it would criminalize the homeless. And we know that many of the homeless have behavioral health issues, whether serious mental illness and or substance use disorders. Would also, unfortunately, really traumatize the many children who are homeless when their parents are homeless. And so it makes it very difficult for them to find any place to stay overnight. The governor's not yet taken action, but a large number of organizations have written to him urging his veto of this bill. Next, please, Alex. So the good news is, and I mentioned earlier that sometimes the best sign of success after a session is to say that we defeated some bad bills, and there were some really bad bills that are dead for the session. House Bill 141 would have removed fluoride from the water and left it to local control. Really appreciate the Dental Association and so many dentists and public health people coming out and strong arguments against this bill. Some of you may know that Kentucky has a terrible reputation and ranking in terms of our dental health. We're among the top 1 or 2 states in toothlessness. And so anything that we can do to strengthen teeth, which of course fluoride does. House Bill 255 was of great concern to those of us concerned about youth, would have targeted 16 and 17-year-olds, would have removed protections that were already in Kentucky law, would have allowed students to even work overnight before a school day and that kind of thing. And our concern was particularly for students who are in families in need of assistance and so forth, that they would feel a real press to forego school in order to keep their jobs. Unfortunately, that bill is dead. House Bill 304, after Senate Bill 150 passed in the 2023 session, really making schools a not supportive place for trans students. This would have even made it worse. It would have required outing of trans students who expressed concerns about their mental health or even began to question their gender identity. I would also point out that there were 3 or 4 other anti-LGBTQ bills that also died this session. I think everyone in the Thrive Coalition worked on House Bill 367, which we unlovingly called the Starve Kentucky Act, would have taken food assistance away from at least 65,000 Kentuckians, including over 20,000 kids, would have also affected feeding programs for the elderly population. One of the legislators who was supporting this bill was quoted as saying, "I don't think anybody should get a free lunch, even poor kids." And we know the kids that are hungry in school and don't have access to free and reduced lunch absolutely cannot learn and cannot concentrate. House Bill 500 really went after some of the gains that have been made by the unions and collective bargaining and so forth, would have taken away guaranteed lunch breaks, 10-minute rest periods, any kind of overtime and so forth. And that also is dead for the session. A number of us were concerned about House Bill 747, which defined educational neglect and actually put the blame on parents for any student misbehavior in school. And one of the consequences was the potential loss of any benefits like food stamps or anything like that for the parents. And we think that there are better ways of addressing student behavior problems. The blame is certainly not solely on the parents. A lot of interest in the DEI bills, the diversity, equity, and inclusion bill. Senate Bill 6 was the one that was moving, although at the end, some of the worst parts of some of the House bills were also put in and would have, I think, really wreaked havoc with DEI programs, not only in colleges and universities, but potentially in elementary and secondary schools. There also was a movement to remove any programs around trauma-informed care, which is what we've done in school safety and resiliency bills since 2019. So fortunately, all of those have been killed for this session, but we need to be alert. These are national bills. They are generated by national groups and then picked up by our legislators. And we're seeing these bills pass in many of our surrounding states. A very dangerous bill was Senate Bill 239, which would have allowed literally the denial of health care on the basis of the conscience, not only of the direct provider, but of anyone who worked in a healthcare setting or any payer of services. And the looseness of the definition of conscience and so forth. We were very concerned about discrimination on the basis of race, religion, gender orientation, and so forth. And then Senate Bill 295 was also a great concern, would have prohibited any requirement for COVID vaccines in all settings, meaning for enrollment, for employment, and work in healthcare settings. So even if a hospital, for instance, wanted to require that all of their workers should have a COVID vaccine, it would not necessarily have been able to be required. So I think we all are feeling good about having dodged multiple bullets during this last session. Next, please. So final slide. Remember that there still are some bills in play, and I've mentioned several of them. House Bill 10, which is the omnibus bill. House Bill 199, which is the birthing center bill. Senate Bill 89, which is Medicaid reimbursement for the professional midwives. And Senate Bill 142, I've just drawn a blank on what Senate Bill 142 is.
Paid leave.
Paid leave, I'm sorry, we talked about that. I just all of a sudden I was like, what is that? It's because the other ones hang together around maternity and newborns and babies, and actually the paid leave does as well, so yes. Just a reminder that 2024 is an important election year. Of the 100 House seats, there will be primary contests for 36 of them. Of the 19 Senate seats potentially on the ballot, 7 of them will have primary contests. So the primary is on Tuesday, May 21st. Registration ends at 4 p.m. on April 22nd. You can request an absentee ballot now, and you can do that at govote.ky.gov between now and May 7th. There will be early voting days in every county, May 16th, 17th, and 18th. And then a reminder that the general election then is Tuesday, November 5th, and there will be 43 House seats and 6 Senate seats on that ballot. So not too early to go to govote.ky.gov to check your registration, polling locations, and other. And need I remind you that elections have consequences. So this is where we're electing the people that are going to be in Frankfurt in the General Assembly session in 2024, 25, and 2026. So research the candidates, show your support, and make sure that others are registered to vote. And with that, I will turn it over to our food guru, who is Tyler from Kentucky Equal Justice Center.
Thank you, Dr. Colonel Schuster. So we've already covered a lot of ground, and we're going to touch base on a couple of those things, but also do a big picture check-in on the food and feeding program. So as Dr. Colonel Schuster said, my name is Tyler Offerman. I work with the Kentucky Equal Justice Center. We do nonprofit civil legal services across the state. So next slide, please. Great. We have talked about this since well before Thrive started doing these slides, but as all of us are probably well aware, Kentucky has many hungry folks, right? We have a lot of folks living in poverty, a lot of a lack of access to health coverage, which we just talked about, a whole bunch. So there's a number of reasons, and food is a part of that story, a part of that picture. But food is interesting in that it's often one of the first things people sacrifice when making the decisions that they have to when living in poverty, right? Skipping a meal is, while still very bad, you know, sometimes a decision you have to make in order to pay rent, to pay for your inhaler, get your kid to school. So it is a big problem, and it's particularly acute in communities that have faced a lot of poverty for a long time. Here's some statistics. Again, this might be familiar to many of y'all. Got a lot of hungry folks. And I will say, it's really hard to get statistics on hunger, right? If you ask someone, have you been able to feed your family today? That brings up a lot of emotions for a lot of people. And you know, that is not always something that folks want to be super upfront about and or seek assistance for, since it often feels like this obligation. So we always say at least 580,000 people. In a later slide, I'll point out that almost 800,000 people are eligible for food stamps, SNAP, in Kentucky. So somewhere in that range, you know, folks are struggling to be able to provide meals for themselves and for their families. That is particularly bad for kids. At least 22% of Kentucky's children are food insecure. We have a big problem with food insecurity for folks 50 to 59, right? You're starting to struggle to be able to maintain full-time employment, but before Medicare and a lot of other programs for seniors kick in. And then there are particular communities that face acute barriers, right? Large cities have several food deserts because of transportation barriers. Several of our rural communities, 43 in fact, have had persistent poverty problems and continue to today. And this is something where we have specific programs for, but again, hunger ties into the broader problems with poverty and just a lack of access to basic needs. So next slide. And unfortunately, you know, a lot of this has gotten worse with the end of the pandemic. There are astronomical food price increases, which every single one of us are familiar with, and you know, no clear end in sight for inflation when it comes to food costs. There's also a litany of pandemic era programs that really help folks get through that crisis that have ended. And that shows up again with food insecurity rates and poverty rates, especially for households with kids who are struggling to find meaningful employment. So next slide. All right, and many of you all know these programs, but these are the big food and feeding programs, the federal food assistance programs. And each one comes with their own set of you know, eligibility standards. So we make sure to keep this slide here just to remind folks that these exist. These are the income guidelines. But as many of y'all know, these programs can sometimes be a little complicated. And it's really up to direct service providers like us to be able to make sure folks know that they are eligible and to be able to provide any assistance we can to get folks enrolled. So next slide. All right, so this was mentioned earlier, House Bill 367, the Star of Kentucky Act. And Alex, if you can just give me a slightly drawn out, dramatic 3 clicks of the slides. Hey, so, you know, a lot of folks put a lot of energy into stopping what was arguably the most dangerous bill during this General Assembly for addressing hunger and making sure folks can keep food on the table. And we did it. Folks came together, we pushed back, and even though a very wealthy out-of-state organization and the most well-connected lobby firm in Kentucky were no match for our people power, and we stopped it. So we can go to the next slide. That being said, it's very clear that there's a lot of work that we need to do when it comes to this General Assembly around food and feeding programs. Dr. Schuster mentioned the "why in the world would I feed hungry children" comment from a particular legislator. And, you know, while it's clear from our work that there is a majority of legislators in the General Assembly who will listen to reason and care about food insecurity, there's a lot that, you know, we need to do some kicking and screaming, some dragging. So I point out that that bad bill that we mentioned earlier, the Star of Kentucky Act, did not pass. Neither did the other bad bill, House Bill 235, but also none of the good bills. So every single one of these bills that the Kentucky Food Action Network was tracking, good and bad, did not pass. So we can celebrate the bad ones not moving, but there was a number of really good bills that unfortunately went nowhere. So I know KFAN and folks across the Thrive will be engaging with legislators during the interim to, one, make sure more bad bills don't move, but also hopefully make a little bit of space for some good stuff. Next slide. All right, we did a budget rundown. There's no way I could go as in the weeds as Dustin, but 3 good ones I wanted to lift up. There was an increase in funding to farm to food banks. That's a program administered by Feeding Kentucky to get local food into food banks. There was also an increase in funding for senior meals. This was, you know, sort of an unknown during the pandemic. There had been some increased funding, and a lot of programs were able to innovate and launch some really great sort of regional, specific to their communities, food delivery programs and other things. So it was good to see that increase in funding continue. And then also the state administrative match for Summer EBT. This was also not guaranteed. A number of other states, especially across the Southeast, have said of this newly created federal program, right? It was temporary during the pandemic. An act of Congress made it permanent. And several states have said, well, that's nice, but, you know, it'll be hard to get the money. You know, our budget's already been voted on, this, that, and the other thing. So Kentucky was actually the first state in the Southeast to say, for sure, 100%, we will do it. But even though the governor made that commitment, it's the legislature that appropriates funds. So if they hadn't chosen to do this, then it would have been really difficult for the administration to follow through on that. So they did it. That is good. And the update on the program is that for the about to end school year, the benefits for the Summer EBT program will be made. The process will start in June. And I will quickly caveat by saying we will learn more information over the coming weeks and months. But as of right now, what we know, so for folks that are directly certified, so those are households with kids, usually on another public benefits program, right? SNAP, Medicaid, KTAP. And the folks that are already have individually enrolled in free and reduced or the National School Lunch Program, those folks will get money. It'll go out mid-June, but there will also be an application opened for any kids that aren't directly certified And this is more than likely, you're at what's called a CEP school. So community eligibility provision, right? Every child at the school gets free and reduced lunch. No one has to fill out a form. And that's because there's enough folks who the state knows are food insecure that they just say the whole school gets free and reduced. So for folks at those schools, you will likely have to fill out an individual application to make, basically do the income verification part of the program. So that application should launch at the same time, and then the cabinet will distribute payments afterwards. It's really that afterwards part that we're waiting for more information on, as far as, what happens if your school district doesn't report your data? What happens if you're told no, but you appeal? So we will get more information out to y'all in these webinars and other formats as soon as we get it. Go to the next slide. Cool. And then this is just our general, these are things we can be doing now. The General Assembly is over, well, almost over. I got ahead of myself, but the Farm Bill is something that we're not talking about because Congress is not talking about it. Even though it was technically due for passage last September, I got no updates. So Mitch McConnell is the only Kentucky member of Congress that serves on the Agriculture Committee. So if you got any Farm Bill comments, send them his way. And then obviously, we already mentioned working during the interim on all of these state pieces. Next slide. All right, and then I'm going to run through these quickly, but we already talked about SNAP, food stamps, the largest feeding program. This is just, big picture. It serves a lot of folks, about 13% of the Commonwealth, brought in over $1 billion in federal benefits, not just to the folks that buy the food, but into the communities where those benefits are spent, the farmers, the grocers, the retailers. And Kentucky has one of the lowest SNAP participation rates in the nation. We're 46th. Only 65% of the folks who are eligible are actually enrolled. So, that's what I mentioned earlier about the number of folks who are food insecure. So there is a lot of people out there who could be getting assistance but aren't. I think part of that is work we could be doing, but another part of that is removing systemic barriers and overly burdensome processes. So that way folks who are eligible can actually get in and stay in. Speaking of terrible administrative barriers, there is this thing in SNAP, sometimes called work requirements, work reporting requirements. And Congress has said that for certain people that they deem working aged and capable of working, they need to work in order to maintain their SNAP eligibility. This was lifted during the pandemic. It's gone back into place. And we just want to make sure that everyone knows what those rules are and the folks that should not be subject to them. Some of them are listed here. So if you have any problems with these time limits, I recommend you reach out to your local legal aid office for sure. Here's a quick map just to show you of those requirements, which counties are they actually being implemented in. This was a big thing in House Bill 367, the hunger bill. They were trying to basically prevent the state from waiving any of these requirements in counties that have high unemployment or persistent poverty. So we were, again, successful. Good job, team. So as of right now, only the red counties, these requirements are in place, but these change every year. So as soon as we get the new list in December, we'll make sure folks know. All right. And another unfortunate myth in SNAP and feeding programs is that there's a whole bunch of people stealing benefits. So we always just want to make sure to point out that based on the data, the actual fraud rate, quote unquote, in SNAP is less than 1/4%. So of all of the people, Kentuckians using SNAP and the number of people who are found to have intentionally defrauded the government, very, very small. A big fraud problem that does exist in SNAP are criminals trying to steal people's SNAP benefits. So this has become a big problem recently. You might know it as skimming, but basically tech-savvy criminals have found ever more creative ways to steal people's EBT benefits. So part of that is you can see this picture on the left. They actually put fake devices on top of card readers to skim your information. But there's new research, or not research, but new cases coming up where folks are actually just using algorithms to guess people's passwords, and that's called tumbling. So, this is something that we really need the state and federal authorities to step up on, right? It's not really, there is nothing clients can do here. Even if they protect all their information to the best of their ability, they can still get scammed. So as of right now, there is a process for some of the benefits to be replaced. You can get that information there, but this is something that we are pushing members of Congress to address in the upcoming Farm Bill. So next slide. All right, and then just a couple more. Wanted to make sure to lift up WIC, women, infant, and children. Also to point out that it is available to not just women, infant, and children. Any dependent who is caring for an infant or a child can apply for WIC. And I point that out because you can see our participation rates are very high for infants, right? Of the almost 30,000 infants that are eligible, 90% of them are enrolled. But once you start to look at children, years 1 to 5, women or other dependents, or sorry, other caretakers for those children, very, very low. So this is something that, we want to make sure folks know. Several of us on this call, but also national advocacy organizations fought really hard in the last couple of months to make sure Congress fully funded WIC, and we did it. And we want to make sure that those benefits go to the folks that need it. So if you have any problems with applying for or receiving WIC benefits, again, I recommend you contact your local legal aid. Next slide. Cool. And then there's just a couple slides here for other programs. We've mentioned a couple, but there's, some for seniors. If you need to find a connector to help you navigate, if you need to find a food bank. And next slide. And just a couple others that are going to be dependent probably on your county or city, but something else to keep an eye out for as you're supporting folks and making sure they can keep food on the table. And with that, I believe I'm going to pass it back to Dr. Schuster.
Thank you, Tyler. And it's I'm up again. Just want to point out that I represent the Advocacy Action Network, but also Mental Health America of Kentucky, which is the oldest mental health advocacy organization in the country. Many years before most of us thought about advocating around mental health, they were doing that. So, and we have a very strong chapter here in Kentucky. Marcy Timmerman is the executive director. Next slide, please. So we had some good news in the budget, specifically around behavioral health. $18 million to cover the pension costs for the community mental health centers who participate in the pension. Dustin alluded to this, but we got $61 million to increase those slots of the 1915 C waivers by 1,925. That is so many more than we've ever had in previous biennial budgets. We have a number of new waivers I'm going to talk about in a little more detail, but we got $132 million for those various waivers, focusing on Kentuckians with serious mental illness, those with substance use disorder, those who are currently incarcerated, but due to be discharged in the next 60 to 90 days, who have a behavioral health need, and also planning for a new children's waiver that would cover autism spectrum disorder, severe emotional disturbance, and children with intellectual disabilities coupled with chronic health conditions. The good news is that there's $94 million over the next biennium to increase salaries for frontline workers. So if you think about how many more people are going to be, how many more slots, placements are going to be available in those various waivers, we're going to need to have the people to provide those services. And so $94 million to increase the salaries of those workers. $5.5 million to expand legislation that was passed in 2017 called Tim's Law. It's assisted outpatient treatment for those with severe mental illness, which interrupts the revolving door in and out of hospitalizations, incarceration, and homelessness. $7.5 million to continue funding school mental health professionals, and then $1 million to address suicide among farmers and agricultural workers. As Dustin noted, there was no funding for mobile crisis, and we're still waiting. There's a big initiative coming from the cabinet. They let a contract with an administrative service organization to really beef up and fill out mobile crisis across the state. So we're wondering what the impact is going to be of the loss of funding that originally was in the budget for those services. So stay tuned on that. Next, please. So new behavioral Medicaid waivers are coming. We have been advocating for 20 plus years to get supported housing and supported employment for Kentuckians with severe mental illness. We just closed the comment period, and our thanks to Kentucky Voices for Health and to so many of our Thrive Kentucky partners for getting the word out. Nearly 100 people and organizations submitted comments, so we're waiting for the Medicaid department to give us their review of those comments and to make any changes in the plan before it's submitted to CMS for approval. We are certainly hoping that this waiver will be up and running by the end of 2024. Another population is that incarcerated population. Typically, Medicaid is suspended when a member is in prison or jail, but this new reentry waiver is awaiting CMS action, which would allow SUD treatment and some mental health treatment to actually begin while the person is still incarcerated, and then it would follow them into the community. So the Medicaid department and some of us have been working on this for 5 years, and we are really excited about this moving to implementation. It's been approved already in California was the first state, and I think in 1 or 2 other states. So Kentucky's going to be a real leader on this. Next, please. So we mentioned all of these new waiver slots, and you may be thinking, wow, wasn't that generous of the legislators? And it was, but this is where advocacy really pays off. We have been dealing with waiting lists. In mid-July of 2023. There were more than 12,700 people on the waiting list for those waivers. My friend Steve Shannon, who takes care of the community mental health centers, calculated that it would take between 22 and 168 years to accommodate all of those people if we only got slots allocated at 50 a year, which is typically what we've gotten. So a huge difference to see 1,925 waiver slots approved. It not only was people on the waiting list, but it was also lots of advocates and lots of people that knew those people that were on those waiting lists that spoke up. There have been several task forces and past interim sessions. So just a big shout out to everyone. And it's really the value of advocacy. Now our work is shifting to, we need to be sure that the staff at the cabinet begins going through those people on the waiting list to do the required assessments and then to manage them to be ready to fill those slots. And again, we think those slots will be ready because we've got more funding for the workers in the pipeline. And we think that agencies that have maybe quit doing waiver services or are thinking about getting out of the business because the pay was so low and the numbers were not that great, we'll see this as a good business opportunity with increased funding for the workers and increased numbers of people coming in and needing those services. So this is a good time to address those needs of Kentuckians with disabilities. The whole goal of 1915 Medicaid waivers is to keep people out of institutions. and to be able to treat them in their community of choice. Next, please. So a couple of bills in the behavioral health arena. Senate Bill 2 is a school mental health bill, which notably strengthens suicide prevention training. We're convinced that it will save lives among students who are very susceptible to anxiety and depression, and unfortunately turn to suicide as a solution to that. Also will strengthen trauma-informed care. There is a negative part of this bill that you may have heard about, where there potentially could be more people with guns in schools to be guardians against attacks by a shooter. But the school districts have to decide whether they want to hire these retired police officers or veterans. I mentioned House Bill 30 that creates the Veterans and Families Suicide Prevention Program. House Bill 56 will help to meet mental health workforce needs. It has a compact, which is an agreement for social workers in Kentucky to make it easier for them to provide services across state lines, and to have other social workers provide services in Kentucky if they belong to the compact. And then it also will put more psychologists into practice sooner in their supervision cycle by about 3 years. So we think both of these will increase the workforce. And I mentioned making naloxone more affordable. We're hoping again that the omnibus bill will pass. It has a very significant increase in mental health services for what we used to call postpartum depression, is now called perinatal mood and anxiety disorders. And then I mentioned before the House Bill 5. We really are concerned about the further stigmatization of those with mental illness or substance use disorders who are homeless, as well as children who are homeless. It also will incarcerate more parents and for longer periods of time. Kentucky ranks among the top 5 states, and this is not where you want to be ranked in the number of children who have or have had a parent who's been incarcerated. So the negative impacts on those kids and those families is really significant. Next, please. So again, I mentioned earlier, we're happy to see more funding in suicide prevention programs. I think Senate Bill 2 and getting more training for teachers and all workers in schools, cafeteria workers and bus drivers and everybody in schools that are dealing with students. But we are seeing an alarming rate in suicides in just about every population that you can think of here. I mentioned $1 million for our farmers. Raising Hope Kentucky is a great website, and I think will be of interest to you. And then LGBTQ youth are not inherently prone to suicide risk, but certainly are at higher risk because of the way that they are mistreated and stigmatized. So the Trevor Project is an excellent resource, and I have a link to that for you there. And then last slide, please. So we have the 988 Lifeline that was started in July of 2023. I'm really proud of Kentucky and our community mental health centers because we're a state where they're set up so that every county has direct services from their local community mental health centers. Our calls are being answered locally and not by somebody in Miami or New York and so forth. They're being answered at the community mental health centers. There's been a 40% increase in calls since it launched in mid-July. I said 23, it was 22. They're being answered much more quickly. Fewer than 2% of the calls were referred to law enforcement or ambulances, which means that they're being taken care of by people talking to people at a time of crisis. So just remember, if you're concerned about somebody, you could call and get information by calling 988. And I encourage you to do that. And I will turn it over to our friend Adrienne Bush to tell us about housing and homeless services.
Thanks, Dr. Schuster. It's good to be with you all. Next slide, please. Okay, so we have touched a lot on House Bill 5. And we have talked about this over the past couple of Thrive webinars. But the most recent development is that it has passed the House and Senate, and the governor can either veto it or let it become law without his signature, or sign it, but he has to do so by today. So we're kind of waiting to see what happens there. Just some quick fact checking for folks. So the majority of the sections discussed here are derived from the Cicero Institute. You can go on their website. They're a group based in Austin, Texas, that was founded by a venture capitalist. And you can see the sections of House Bill 5 in Kentucky match up pretty darn well with their model legislation on their website. In Kentucky, obviously, they put it into this huge 78-page bill, so it's kind of buried in there. And so we just want to reiterate, we like public safety. We think it's a good thing. But the thing is, the housing and homelessness sections do not actually do anything to make us safer. And even though the point of the bill ostensibly wasn't to address homelessness, it nonetheless will impact Kentuckians who are experiencing homelessness. And here's how. Next slide. So I'm going to run quickly through the provisions because a lot of them did not end up changing, although we were dealing with multiple versions, particularly in March. So the final version of the bill bans street camping, and that includes all of those things listed. It does exempt people sleeping in vehicles when they're parked legally for less than 12 hours. But everything else, everywhere else, is still subject to criminal penalties, including $250 fines and up to 90 days in jail. Next slide. All right. Section 18 would deal with homeless assistance funding, which largely comes from the federal government. So the final version does remove the word federal, and it amends the requirements on behavioral health and/or substance use rehabilitation to state that the programs must facilitate access to such services in order to receive the non-existent state funding. It also exempts any statutorily authorized housing programs. Here's the thing. This section is still unnecessary, and it's really grounded in misinformation about what causes unsheltered homelessness, and that is the lack of housing, the housing shortage. Are there confounding factors, mixing up words here? Yes. Is there some overlap between behavioral health and mental illness? Yes. But fundamentally, what causes somebody's lack of a home is the high cost of housing and the shortage. Next slide. Section 19 did get changed. Section 19 stayed exactly the same. Basically, it authorizes local governments to designate state-sanctioned encampments, which they already do not require permission from the General Assembly to do. Section 20 did get changed a little bit in that the thing that is still the same is that local governments have to enforce these sections of House Bill 5, and the Attorney General could bring suit if they did not. The final version of the bill expresses an intent to allow local governments to enact diversionary policies and offering of services. That doesn't provide those services, doesn't provide those resources, but it at least theoretically lets local governments have those policies. Next slide. Section 21 expands Kentucky's Stand Your Ground law. We've covered that. Sections 10 and 11 further criminalize residential rental damages. And we've already talked about the process updates, so I'm sure you'll see coverage about what happens with House Bill 5 today. Next slide. Oh, but I do want to say something real quick. And that is, I want to thank everybody who did speak out against House Bill 5. There were a lot of people coming from a lot of different areas of Kentucky and a lot of different walks of life and a lot of different perspectives. And sharing your perspective letting your folks, the legislators, know we're not okay with this. This is not what we actually want. I'm very, very grateful for all of you, especially those who came from very far away to testify. Next slide. Oh, no, we're on the right slide. House Bill 18, Dr. Schuster did cover this. Just wanted to note it's a ban on local discrimination bans, and that it does have an emergency clause on it. And so therefore, Louisville and Lexington's fair housing ordinances are null and void as of right now. Next slide. House Bill 100 is a good bill. It does remove or minimize barriers that people actually have to getting housed. And so we're very grateful for its passage. It has been signed into law, or signed by the governor on April 5th. It is now law. It does not have an emergency clause, so its effective date will be around July 1st. Next slide. House Concurrent Resolution 68 would establish a legislative housing task force. Many, many bills in the session covered or touched on housing. We have had more discussion on housing among our policymakers in the last 3 months than we had in the last, 3 years. And that's a good thing, but we need a comprehensive look. We can't just say, we're going to deal with this little piece over here and expect it to not have ripple effects across the entire housing market. So the House did pass this bill. They passed it at the very end. It is in the Senate. It's unclear whether the Senate will be able to actually pass it. But even if it does not technically pass, we feel very good about it being established at the May meeting of the Legislative Research Commission, as has been done with prior task forces, such as the Severe Mental Illness Task Force that Dr. Schuster successfully advocated for years ago. Next slide. All right, appropriations and revenue implications for housing. So you may ask, if the legislature is going to criminalize homelessness, which they did by establishing a new crime and then assigning jail time and fines to it, what are we doing about actual housing solutions? And are we putting any money towards actually housing people? And the answer is it's a mixed bag. It falls far short of the $200 million that the nonprofit advocates had asked for. That was a unified budget funding ask to go across all of the housing trust funds. And it's not enough to make a dent in the housing shortage. So House Bill 1 contains a few provisions. One is the Rural Housing Trust Fund that was established last session. It appropriates $10 million for the housing gap that is left behind from the tornadoes and the floods. House Bill 1 also provides money for a project in Lexington, as well as a project in Louisville, we think is about $20 million. And then a homeless initiative in Owsley County, about $500,000. So there was nothing in there for the statewide Affordable Housing Trust Fund. There was nothing in House Bill 6 for anything housing or homeless related. House Bill 6 was the ongoing state budget bill. And in House Bill 8, which was the revenue bill, we did obtain no cost IDs for people experiencing homelessness. We were able to get the fee reduced from $10 to $5 last session, and it will go from $5 to $0 this session, which is good because we're going to need it thanks to House Bill 5. Next slide. All right, federal appropriations update. Basically, we're in kind of a halfway decent situation given the fiscal constraints that Congress put on itself last summer. And they finally passed the budget, as we touched on last month. Housing ended up okay-ish. Next slide. All right, housing supply. So you've heard me talk about the housing shortage. That is what is driving rising unsheltered homelessness and housing insecurity writ large. So the National Low Income Housing Coalition does a report called The Gap, every year. They release their version of it this spring. And they indicate that we are short about 88,000 units statewide. But I do want to say coming up this month, our state housing finance agency has been working on a statewide housing needs assessment that will deal with both rental and home ownership. And so I'm looking forward to hearing that and getting some county by county numbers. I know all of you will be excited about that too. You can register for the Zoom. And then lastly, Louisville has updated their housing needs assessment that was so well done in 2019. But that does indicate, it is so clear, we have a rising number of unsheltered homelessness. We have a rising number of units, housing units needed for extremely low income people in Jefferson County. There you go. Next slide. Lastly, there is a Supreme Court case coming up, oral arguments on April 22nd, decision by June-ish, in June, that will literally ask the question, trying to answer the question, whether it's constitutional for governments to criminalize homelessness. We, of course, do not think it is. And there will be some activities across Kentucky. Louisville is planning on a big event the day of the oral arguments. You want to get in touch with some of the folks who are doing things and be a part of that, just get in touch with me. I can put them in touch with you. All right. I think with that, I'm done. I can turn it over to Priscilla.
Thanks, Adrienne. Hi, everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health. Today, we're going to cover Medicaid renewals and special enrollment periods. Next slide, please. So if you've joined us at all in the last year, you probably already know, but Medicaid renewals restarted last April, and they were originally planned to have the last batch initiated for this month in April 2024. However, DMS announced last month that they are extending into May 2024. So they are redistributing 40,000 cases, or they have redistributed 40,000 cases from April to May. Just to spread out the caseload quite a bit. The last 3 months have had over 100,000 cases, and so, or close to 100,000 cases, along with quite a number of other system changes happening. And so they needed a little bit more time to run through and initiate all of the cases. As of the end of March, 96% of all of the cases had been initiated, except for children's renewals. So we're still in a good spot, and there will be a couple more changes that are coming up in the next couple of months. So again, all of the renewal dates are in the system. There are some good resources on the Medicaid unwinding.ky.gov page. And if you need any help at all, please reach out to a connector. Please connect to a connector. If you have any questions, please let me know. Next slide. So these are the notices that all members are still receiving. They will receive one of these 3 notices before their Medicaid is terminated. So please keep a lookout for that. But there are also 2 new notices that were just sent out last week. Next slide. So last week, Medicaid announced that 29,000 Kentuckians had their Medicaid reinstated effective immediately. Now, that coverage was reinstated for members who were passively renewed, when they went through the passive renewal process, they were deemed eligible for a qualified health plan, but did not enroll in a qualified health plan, or had some gaps of coverage between losing Medicaid and enrolling in a qualified health plan. It's a little bit confusing. But essentially Medicaid is reinstated back to the date of loss of coverage, and all of the members who receive this are going to receive, all of those 29,000 people are going to receive one of these 2 notices. Now, this notice on the left, a shorter notice that's on that green, it's saying, okay, your coverage was reinstated back to the date of back to the day that you lost Medicaid coverage wow, reinstated back to the loss of coverage. And it does not count any time that you were enrolled in a qualified health plan. However, if you were either uninsured, enrolled in a private health insurance plan, or enrolled in an employee-sponsored insurance plan, this does, your Medicaid coverage will be reinstated. And for all of those folks, you should submit any claims for any medical care or services that you received during that time since you lost Medicaid. It's reinstated as fee for service, so it's not going through MCO or anything like that. And all you need to do is have your provider, ask your provider to bill Medicaid, and they can take care of that for you. For these members who get this green shorter notice, the notice is not green, but the shorter notice, their Medicaid is approved and active ongoing. There is no further action needed until your next renewal date. You are set. For the other group, they will receive this longer notice that's on the blue. It's all of the same information, except that you will have to take action to keep your Medicaid. At the towards the end of April, beginning of May or June, you'll receive a renewal packet, and you have to fill that out to be able to keep your Medicaid, to be able to see if you're still eligible for Medicaid. If you do not, they will send that Medicaid renewal packet. If you do not return it, if you do not fill it out, your Medicaid will end at the end of the month. That is on that notice. So it's super important that one, if you get this notice and you have any claims whatsoever, please reach out to your provider so that they can bill Medicaid for all of those services. And two, if you do receive a renewal packet, the same as always, you have to fill it out and send it back in to maintain your Medicaid coverage. Otherwise, it will end. And if you have other coverage, that's great, but then you'll need to look at qualified health plan or something else. So it's a little confusing, but this is a good breakdown. This notice was sent out to everyone last week, so members should receive it sometime this week or next. Next slide, please. Okay, as an update, the March data, March renewal data was due yesterday, so it's not released yet, but we have an update for February. Like I said, there were 93,000 cases due in February, 64,000, over 64,000 were approved, 10,000 were terminated, and 18,000 did not respond. And so they were extended for another 30 days with hopes of giving them some more time to respond. If you, again, know of anyone who needs help submitting documents or needs help trying to complete their Medicaid renewal, please reach out to a connector. Please go to the KY Unwinding page, or message us for some help. I can help direct you. So next slide, please. Great graph just showing how Medicaid enrollment has changed over time, especially with these renewals. Medicaid enrollment has certainly dropped off. Next slide, please. Trying to scroll through a little bit. Again, if you get a notice saying that you're going to lose your Medicaid, or that you have lost your Medicaid, the first thing you want to do is make sure to go into Connect and update your application as soon as possible. If you need help doing that, you can reach out to the call center, find a connector, or you can do that online, again, at connect.ky.gov. And you also have a right to a reconsideration. If you lose coverage, you have 90 days to submit that document and get coverage reinstated back to the loss of coverage. So just because you lost coverage March 31st because you didn't submit documents, there's still 90 days to submit that and have your coverage reinstated. And you also have a right to an appeal. Next slide, please. Okay, there continue to be ongoing stakeholder meetings from the state. They're every third Thursday of the month at 11 a.m. You can register at the link that is on this, the link that is there. They also have great data reports that live there. So there's almost 12 months of data on the website right now, demographic reports, and there's also a great frequently asked questions document that collects all of the questions from all of the stakeholder meetings over the last year and just catalogs all of them. And there's also a good provider portion as well that asks about that answers some of the questions that providers more specifically have. Next slide. Excuse me. So, wow, that's a bigger cough than I thought. So 20, like I said, some of the renewal issues that we've talked about, those 29,000 members who had their coverage reinstated, that is all because of reports from folks like you, from assisters, from connectors, from legal aid folks, from consumers who are saying like, hey, something is not quite right with my case. Can you look at that? All of that helps us identify issues that we can escalate to the state and have them fix it at a larger systemic level. And because of that, again, 29,000 Kentuckians had their coverage reinstated this month. Another big change that we've heard a lot about in the first 6 months of unwinding, but continuing through the renewal period, members losing their SSI income and then being blocked from being able to apply for Medicaid. They just lose their Medicaid coverage and then have a period of being uninsured before they can reapply for Medicaid. That is because of a system issue, and that will be officially fixed at the end of April. So that'll be a great change that'll make it easier for folks who some have SSI income or some lose eligibility for that. If you know of any other stories, any other cases, any other things that you're seeing that are just problems or issues that prevent people from completing their renewal, please lift them up. There's nothing too small that we can't look at and figure out if there's something else that's going on that might need to be fixed at a systemic level, because the likelihood is that if one person is seeing it, lots of other people are seeing it too. So please don't hesitate to report all of that. My contact information is there, as well as our KY Loop Facebook page. So next slide, please. All right, it is outside of open enrollment, so there's a great long list of special enrollment periods. For anyone who has lost coverage, that is the #1 special enrollment period. Please don't just choose to be uninsured because you think that you're outside of the open enrollment and can't get coverage. There are lots of special enrollment periods that can help you get coverage. And if it's not one of the traditional ones and there's something exceptional or special about your circumstance, also reach out to a connector, because there's big likelihood that the state will look at that and can individually approve a special enrollment period. So we also have a great explainer that's linked there as well. So check that out for more information. Next slide. And the last slide, a fix for families. This is a major fix that went into effect last year. That means that now families can more easily qualify for assistance through Connect. There's also an explainer here to go into it a little bit more. But usually when a family member is eligible for employer-sponsored insurance, before this fix, the rest of their family was blocked from getting assistance on the marketplace. But now that is fixed, and so family members can now be eligible for premium assistance and assistance on the marketplace, which really makes health insurance on the marketplace more affordable. So, if you've shopped before and you thought it was way too expensive for your family, or if your family only has really expensive coverage through your employer, please go to Connect and check it out. There's a pre-screening tool that can help you do the math to see if you might be able to save your family some money. So with that, I think that's the last bit. I'll turn it over to Emily. Thank you.
Thanks, Priscilla. And there is a question for you in the chat if you have a minute, but also may have to be something to connect after this call, since we're at the end. Just wanted to remind everyone again about our roadshow. Here's all the information. Please register for one of our locations, share with your networks, and let's go on to the next slide. Here is our growing list of explainers. Priscilla just talked about the Family Fix explainer. We have a number of others on different topics, and they're in English and Spanish, and we will continue to add new topics as they come up. And these are also all available on kyloop.org. And I will leave the rest of our resources for you to peruse as you get the slide deck in a follow-up email along with the recording, the evaluation. Please be sure to provide us your feedback on what you want to hear more of.